That was perfect.
Okay.
So tell me your name.
Andrew Lewis.
And
like a police light.
no. And what do you do?
Veterinarian. Large animal veterinarian.
All right. And tell me if, since you have taken the A.C.E.S course, what surprised you most about it?
Well, you have to retrain your mind to think in a completely different way. It's not traditional in any sense. Maybe it is traditional, and traditional medicine is not. I don't know what the answer is there, but it's you're recircuiting the body. You're trying to help rewire the body so you get communication back. So you get perfect function with everything. So we don't typically think of that in traditional practice by any means. We're looking at disease processes, and this is not that. And that was something that I had to overcome, kind of come to grips with. That while we may be quote unquote fixing things, it's you're maintaining health and promoting health versus fixing a problem, so to speak.
Okay.
And it's preventative as well. So it's just a completely different it's a different approach all the way around to evaluating an animal. Completely opposite of what you normally do.
So now that you know how to do animal chiropractic, how much are you using it in your practice?
I use it quite a bit. I adjust horses every day.
All right. And is there anything that you have learned that you wish you had known before? Like that you say, man, if I'd have known this sooner.
Sure. Yeah, I mean, there's a lot of horses out there that I had to say, I don't know what's wrong with your horse. You try X, Y, or Z, and we do what we do. As lame as diagnosticians, but if you have a chiropractic lesion, so to speak, I'm not going to be able to fix that. And so there were those. I'd say, hey, well, see if a chiropractor can fix it for you. That's what I got. I said, I've done this, and this, and we're coming up blank. And so I had to send a lot of patients away for something I couldn't give them a good answer for. And now I just walk up to them and go, okay, yeah, no problem. We got this. Boom, go run the pattern and see what it looks like. They do it in our arena, and all of a sudden the horse is turning where the horse wasn't turning before. So, it's really complemented our practice.
Okay. And are there any reasons that you use animal chiropractic now that you, before you took this course, wouldn't have even thought to use it for?
Yeah, I mean, there's a lot of different reasons to use it. You can justify using it on any case, but certainly I use it the most in sports medicine, I think, because that's what people most commonly think of when they think of it, at least in the horse world, at least where we are.
Mm-hmm.
So, I use it sometimes as an adjunct, or strictly that's all I do to their animal, and their horse goes on and performs just fine. Mm-hmm. So that's the biggest thing that I use it for, or I use it in. But I've had other patients that, they were having difficulty eating, difficulty dropping their head to graze, those kind of things. You adjust the horse, and those horses go on and they're able to function and do things that they haven't done sometimes in a long time. So I had one that when it ate, it had to drop down like a foal does, split-legged, in order to get its head down to graze. And that was just an aside. The horse came in, it was a roping horse, and it was just stiff. And so I adjusted the horse, and the horse immediately walked over and started grazing like a normal horse. So I said, the horse has never done that before. I was like, well, yeah, I mean, that's what we do. So now, I was completely surprised, but I didn't let them know it. So, but, you know, so the stuff works. You know, it's not a gimmick. It's not anything else. There's too much. There's too many results out there, immediate results that you see that, you know, that you can't explain by anything else you've done. So,
Right.
it's good stuff.
What would be any one word or feeling you might use to describe the course that you took and how you feel about it?
Well, I think it was, you could say, probably amazing, because it's, like I said, it opens your eyes to a completely different world and a way of thought that, again, had I stuck with traditional practice and nothing else, I'd have never known about it. You know, I never would have gone and really researched about it. Mm-hmm. You know. So, I mean, the main reason I did it was because my brother did acupuncture, took an acupuncture course. I was like, well, maybe I should go try a chiropractic course. I said, we send a lot of horses to be adjusted. I said, let's see what happens, you know. Might be, you know, you do it for monetary reasons at first. You know, this could be a good addition to the practice. But then once you get into it, all of a sudden it's a different ball game. You know, yeah, it's a moneymaker. I'm not going to deny that. But it's added value to the practice. And a lot of times it saves the client money. So, and it cuts my overhead down. So there's a lot of benefits for everybody, you know. So, and I'm not having to use near the amount of drugs that I was using before. So,
So have you paid for the class yet?
Yes. Yeah, I've paid it off easily, you know, and I still pay a drug bill every month. Still got all that kind of stuff, but this is paid for, you know, and so everything beyond this is net. So, you know, I profit, the animal profits, and that's the biggest thing, you know, and we enjoy it. I mean, you know, it's neat to see immediate results as opposed to immediate results from a nerve block where you know, yep, that's where your problem is. Now we got to do X, Y, and Z, you know. So there's a lot of credence to this. So, yeah.
Awesome. Anything else you want to say?
Thanks. I mean, it's been good. I've enjoyed it. It tests you mentally. I mean, it's a very trying course. It's not a cakewalk at all. But you come out of it enriched. You really learn a lot. You learn a lot about yourself as well and the outcome, you know, and how you want to be. And I think if, as a veterinarian, I went into it because I wanted to help animals. You know, we naturally have that. You want to be compassionate towards an animal. And this is one more way to be compassionate and help a patient be at their best ability.
Awesome. Thanks.
No problem.